Okay, it's Tuesday and we just finished lecture. So we did a differential diagnosis on like rotator cuff pathology in the shoulder, and Jared and Liz are going to talk to you more about how our differential diagnosis lectures usually go.
Alright, so they give us a worksheet to fill out for before lecture, and then during lecture it's more of like a discussion based versus somebody just lecturing at you. And then we talk about like the more like specific like symptom presentation that an athlete or like a patient would have in the clinic, and then we also talk about like other like alternate diagnosis, and then how to kind of like rule in or rule out if two diagnoses are like very similar, just some of the keys to pick up on. And so then they're also like they talk about specific tests that they want you to use, so like the more like sensitive or like more specific tests that are better versus like in undergrad how you just learn a clump of tests, and then dive into like the objective exam, like what you would see, what you should look for, and then like what could be causing the pain or what could be causing that like deficiency. So not just like, okay, they have like a slap tear, but like also like what could be causing that pain other than that. So
yeah, the thing I like about our lectures is that as Liz mentioned before, it's a little different style. So you're not going to be sitting and looking at a PowerPoint while the lecturer is reading off the slide. You're going to have to answer specific questions about the conditions that are going on, and be able to differentiate which conditions are the same and which ones are different from ones that you previously may have learned. And the thing that I like most about it is, though we might go over 5 conditions in a class, we'll be able to specify which conditions are specific to the high school population, which may be consistent with patients we see here in the clinic. So that's something that I really enjoy and something that I think is a big benefit, because when you go into an eval, you need to know going in what exactly you're looking for, whether that be good or bad, right? And a big part of our lecture is also being able to rule out things that we can't take care of. So you've got to know your scope of practice and be able to operate within that. So they teach us a lot about what to look for as far as red flags there are, to know that when we're treating somebody, we're going to actually get a positive result, instead of just barking up the wrong tree for a long time. So it's really helped me as a clinician.
Yep. Just to add on to that, I would say that like the biggest benefit of lecture is talking about how to really streamline your evaluation and do just the right number of tests based on their specificity and sensitivity, what's really going to tell you what rules in, what rules out, and how to get to the pain generators that you're working with. So that's what I would say about lecture. All right, this is Marie Sharpenshea. She's our program director. She's also a certified athletic trainer and physical therapist here at Methodist. And she's going to talk about our exam structure and setup and kind of what we get out of the residency.
Okay, so as far as exam structure, our residents do one exam after each of our modules. So we have like a foundations module, we have spine, lower extremity, upper extremity, and then our advanced interventions module. The exams are multiple choice, so the answer is on the page, and they need to pass with a 70%. As far as what do we want our residents to get out of an athletic training residency program, first and foremost, it's improving their clinical reasoning. We teach them a lot of different manual therapy skills as they pertain to orthopedic rehabilitation. And then we really talk a lot about specific exercise selection for the athletes that they work with. In the future, Katie is working on developing specialty exams. So at some point, our residents will be able to sit for a specialty exam and get a certification.
That's what a typical Tuesday is like, and that was a little from Marie about the benefits of the residency. I'll be back again tomorrow talking to my clinical mentor about how our relationship goes, and we'll talk about how we get our continuing education credits. For now, we're going off to the high schools to work for the afternoon.